Yeah, thank you. Morning, everyone. Thanks to GovConnect for inviting me to come and speak today. I'm Pete Waddingham. I'm the Net Zero lead for the Academic Health Science Network. When the draft agenda was sent out, I got the title Delivering Net Zero, Creating Green Economies. And I said, actually, I don't know if that's the right title for me. And they said, that's fine, you can change it. And then I thought, no, actually, I'm going to stick with that title. And I am going to briefly touch on green economies because it's important. And last night, just when I was getting myself ready to come here, I was Googling the Royal Society of Medicine, just get my bearings, had a little look at the sort of history of the Royal Society, and just on the crest there, below, there's a bit of Latin, and it says, to enjoy good health, it's important to enjoy good health to live fully. It is important to enjoy good health to live fully. And I kind of pondered on that for a bit, and I'm thinking, this is the reality. We've got something, as Kim has so passionately spoken about, but people are dying. The climate emergency is causing some real problems, and I just don't think we're allowing people to live fully because we're not allowing them to enjoy and have that good health through the air pollution, through the fact that we've got concrete jungles and we've disconnected ourselves to nature and a whole host of other things. Some of you might have been getting bit a lot recently. I've been bit quite a bit, and that's no surprise. Things like mosquitoes are on the rise because of warmer weather, climate change, etc., etc. So yeah, it's an important topic for many reasons, but we obviously want people to have fulfilling lives and to live healthily. So just in terms of our plan of action, I will whip through in 15 minutes. I'm just going to briefly discuss green economies, touch on the climate emergency. It's been mentioned, but I don't think it's a problem. I think we all need that daily reminder. Obviously, I'll talk a little bit about who the AHSN are and how we support innovators, for those that don't know. I want to share some of my interests and thoughts because, again, having a platform like this, it's nice to be able to share the things that I'm interested in. Some challenges as well, a bit like Kim's touched on, and in fact, there is a bit of overlap. And then I'm just going to finish on the importance of having a vision. So just in terms of green economies, like everything in life, there's always numerous definitions of what is a green economy. But I quite like this one from the Organisation for Economic Cooperation and Development. But green growth means fostering economic growth and development while ensuring the natural assets continue to provide the resources and environmental services on which our well-being relies. And again, there's a couple of kind of sub-bullet points, but it's about unlocking opportunities for innovation and stimulating that demand. And I think all of us, when we're telling people that it's important to deal with this topic, we've got to think about that wider picture. We need the economy to grow, but we need sustainable economies. We obviously need jobs, people need to work for a variety of reasons. But I think the green economy can absolutely unlock that new growth. I've got young children as well, and I look and think, what might their job be of the future? And I hope it is contributing to a green economy. And I think by creating that demand in the health service, we are stimulating that economic growth. And as I said, it's nice to see a bit of a switch, not just focused on GDP, but on the natural assets that are important to our well-being. And I just wanted to finish in terms of economy on this report that was done by the Yorkshire and Humber AHSN, the organisation that I'm hosted by and previously worked for, but it was a levelling up report. But we know there are strong links between improving people's health and economic growth. We need strong economies because that helps improve people's health. So there's lots of research around that, but it is important. I'll only touch on this really quickly, but I mean, as I said, we need to really keep hammering this in our head. It's likely from the latest report in 2023 that we're not going to hit those targets. I mean, we've got lots of targets that people talk about. We know it's a climate emergency, but let's sort of step back a little bit. It's likely that we're not, going to hit them targets, and warming will exceed that 1.5 degree mark. You've seen similar graphs like this. I mean, that's the historic trend. That's what we need to do to get to, various temperature targets. I mean, if ever there was a graph where you look and think that looks unrealistic to do, but that is the scale of the challenge to hit those various targets. And you see similar graphs in the NHS plan, and there's lots of different areas around energy decarbonisation, models of care, the supply chain, and actually innovation cuts across all of those. And certainly the AHSN, and I'll talk a little bit about this in a minute, have been looking into areas like energy, like changing pathways and models of care. I still think there's lots of scope in there. I've had recent interactions with the NHS, and I just think there is so much more we could do, and we're working with a lot of suppliers as well, which again I'll tell you about in a bit. Just briefly who the AHSN are. We're seen as like the innovation arm of the NHS. We try and connect industry, the NHS together. and create that right environment for collaboration and for innovation. Not an easy task, I'm sure you'll agree, because we know the pressures that are on the NHS. And if you don't know, there are 15 AHSNs up and down the country, and we are a network of networks. As I said, I was previously working for, I'm still hosted by the Yorkshire and Humber, but we come together to talk about net zero. We've got a really good community that's been put together over the last couple of years, and it's nice that we're all really trying to contribute to this important agenda. Just some thoughts about how we help HSNs that are certainly important to me, but I do think we're good at brokering relationships. I try and do it a lot in my work. I think there's absolute strength in collaboration. Obviously, we try and broker relationships between innovators and the NHS, but actually some of the strength comes from innovators collaborating together. We try and help articulate that need and what the challenge is, and again, as Kim's mentioned, measurement and quantification, massively important. So I've been doing some thinking around that. This one is really important to me as well. We act as a critical friend. Many innovators come and talk to me, and I just want to sort of sound it out and think what might prevent this from being adopted. And sometimes I sound very negative, but I want to help every one of them. I don't think there's really been a bad innovator that's certainly crossed my path where I don't think they've got something to offer the system. But we do need to act as that critical friend. The funding landscape, we've just had the SBRI launch this week, which is great. It's a pot of money, but actually there's a wider funding landscape out there. And it's important for us to help innovators navigate that landscape. We do work around evaluation. A piece of net zero evaluation that I've just seen done by Eastern was around a little product that goes in a fridge. So if the electricity goes off, it doesn't ruin all the vaccines and the medications and all the waste. And they've done an evaluation piece on that. And the other thing that I try and do as well is manage expectations and support innovators on that journey. Innovation does take time. The NHS is notoriously frustrating to access and be amongst, so just sort of managing those expectations. Just a couple of companies that kind of spring out, and there's lots actually. But Open Medical, they've just won the Innovate Awards, Net Zero Award last week, doing really well. It's a surgical platform. Again, they've built some carbon quantification in there. A previous SBRI successful applicant. Patient Knows Best. Fiona knows them really well. It was through the Sustainable Healthcare Coalition that I got to know Tom and team. But I really like what they're doing. Again, it's about patient empowerment of information. They're looking at their own business. What is their own carbon footprint? How could that have an impact on the pathway? And when you look at their logo and the strapline, the Patients and Planets Company, it shows you that they're building net zero into the heart of their business. UMaker, I was on a call with them yesterday, the Sustainable Medicine Partnership. They're doing lots of great work. There was the conversation yesterday was on electronic patient information leaflets. Massively important. The amount of trees that are just getting cut down for leaflets that no one's even using. There's a big piece of work on that. But it's not just about net zero. People want accessible information in the language of choice, in the format that makes the most sense to them. That's certainly not a tiny little leaflet in a box. So that's another great piece of work. And Revolution Zero, another one that's close to my heart. I remember when Tom and co came to me with just an idea, and actually they're getting some real good traction with circular economy and PPE. There's lots more companies. We did a green hospital session last week, or a couple of weeks ago, where we showcased sort of 50 innovators. And again, there's some brilliant organisations. I've seen Roadvent just showcasing in the foyer. So really, really good companies, and I can't do them all justice. Just some personal thoughts from me. Data, like Kim said, data and measurement is absolutely cornerstone for me. We did an event on it recently. I'm still having conversations on it. I think, the whole world of carbon accounting, life cycle analysis, it's got a little bit complicated in this day and age. That for me is just mind-blowing, that we've made something so complicated and can't easily measure, as again Kim sort of alluded to. So that's why that topic's important to me. But I think what you've heard as well throughout the sort of morning session, and hopefully a little bit of flavour of what I'm talking about and what Paul said as well, there's lots of great stuff already there across various things, changing pathways of care, etc., circular economy. And innovation, I like that phrase as well. It comes from the Latin meaning to change or alter things that already exist. Sometimes we don't have to reinvent the wheel. Just some barriers, and again, I know Kim's touched on some of this, but the time to think. People are under a lot of pressure. Boards are thinking about cancer targets, etc. Understanding the urgency, again, we've talked about that, and Kim said about consequences. Finding the solutions. It's not easy to find the solutions. That's why I think the HSNs play a good role in that. We can be that sort of middle ground. We can filter things, etc. Articulating the business case, finding funding, the risk, And the skills and knowledge, again, they're all massively important. And again, I absolutely love that quote. We'll go down in history as the first society that wouldn't save itself because it wasn't cost effective. I mean, it kind of sums a few things up. Just a couple of my thoughts, and now we'll wrap up really quickly. Role of innovation in net zero. Innovation is essential for achieving the ambitious goal of net zero emissions, which requires a significant transformation of the current economic and energy systems. Blah, blah, blah. I won't read the rest because actually I got ChatGPT to write that a few months ago because I'm really interested in AI. I strongly believe that AI has some solutions that we absolutely need to tap into to help us on the net zero agenda. Sometimes AI is frowned upon because obviously people think of it as like a lot of energy consumption and servers, but I'm adamant, and I've seen some brilliant people already working in this field where AI can massively help. And again, just to bring to life AI, because I do follow it quite closely in terms of a topic, I was on a call the other day, someone presented a really complex diagram, and I'd just seen Google had launched their update to their AI software, and it can interpret images. So it's not a case of going, oh, this is a dog, this is a cat, looking at pictures. It's looking at complex things and giving you meaning and explaining exactly what that is. And so, AI, the reality is it can see, it can genuinely see now, which is, and it can speak, and I'm sure it can hear, and I'm sure it can probably touch and smell. So, it's the senses, but I just think it's a great topic. And it's what I'm interested in. A bit like Kim said, if people are interested in these topics, reach out to me. That's where I want to put some effort and focus. Lots of other areas, I said, that I'm interested in, but certainly that does. Just to finish on a quick story, Star Wars, again, I quite like Star Wars. Over the years, what do we see in it? We see lots of robots, drones, we see AI, we see voice-activated robots, manufacturing robots flying around, etc., and more. And actually, look at the world we live in today. We've got some of these. I mean, there's Starship Technologies on the bottom right that I know is getting rolled out into towns and cities, delivering you shopping. There's Amica, the robot with built-in AI. Tesla bot's not on there, but I've just seen that again recently. So why am I telling you all of this? Well, actually, what I think humans are very good at is implementing innovation to meet a vision of a future world. So we kind of think about what future we want, and then we go ahead and implement it. A bit like Star Wars, people have imagined that, and then they've gone and created the technology to do that. So I think it's really important for us, if we want to do that and know that humans are good at that we need to have a vision of what a green, sustainable society looks like. And I look at images like that at the bottom, and I think that's the kind of world I want to live in. I have got no qualms with technology. I love technology, but I want to see it in a green, vibrant city. I don't want these concrete